Hey YouTube, this is my first video. Uh, this is basically going to be a overview for 4 to 5 minutes on my back problems. I'm going to be getting a laminectomy next month. That's where they shave some of your vertebrae out, and they're going to do a discectomy and cut down two of my discs. I have two herniated discs, L4, L5, and L5S1, and try to get the disc off of the thecal sac and the nerve root to try to reduce my leg pain. Uh, I'm going to start with a basic background. I'm going to do a video a week after my surgery just to give everyone an update for anybody that's thinking about doing this. I know a lot of people that are in massive back pain really try to jump on anything that might give them hope because of the fact that they're in such a high level of pain. Uh, you kind of take a step back and try to assess any service or any surgery that's going to be offered to you and actually do things the smart way if you can. So my basic background is two herniations, a minor disc tear. I opted for the laminectomy. It's minimally invasive. They say it's a 6 week period of recovery, and then you can get back to doing your running, swimming, jumping, playing, whatever it is that you want. So I'm going to start with some basic things that have helped me, some things that haven't helped me, some medications that have helped me, some medications that haven't helped me, and just a basic overview for a couple minutes. One of the major things is this. I've been dealing with this on and off for a couple of years. This past year and a half has been the longest and worst stint. To move from Florida to Rhode Island because the pain was so severe. In that time period, I was 170 pounds. Now I'm about 200 pounds. You really want to control your diet because you're not going to be able to work out. You're not going to be able to move and burn as many calories as you normally would be. So, you want to do the three servings of vegetables, 3 servings of fruit. Keep it lean protein. Try to do a gallon of water a day, and really control your alcohol and your carbs and your sugars and that kind of thing. Because you'll gain weight really fast because of the fact that, at least if you had a relatively active lifestyle prior to this, and now you're stagnant, you're not going to be burning anywhere near the amount of calories that you normally would be. Another big thing is physical therapy. Find a good physical therapist and do the exercises. In the beginning of this whole thing, about a year and a half ago, I did physical therapy for 3 or 4 months, and I didn't continue with any of the exercises that the physical therapist gave me. I didn't take it seriously because I just didn't care. I thought my body would fix itself, I'd get out of pain. When your body doesn't do that, you need to take the physical therapy seriously. Do it for 3, 4, 5 months. Do the exercises every day, twice a day. Do it really hardcore. And if that can reduce your pain level, say if you're at a 7 or 8, and after 3 or 4 months that brings you to a 6 or 7, that's a little victory. And you have to combine as many little victories as you can to reduce your pain. Because there usually is not, aside from the last line of surgery, there is no magic wand that's going to fix this thing. You have to fix it little by little. Do your stretches. If you have tight quads, I feel like that can kind of lead to some more back pain if you don't stretch out. A lot of muscle spasms will start, giving you bad nerve pain. It's sciatic. That's what I have. Really bad nerve pain going down both legs. Try to get a massage once a week. This doesn't have to be a professional massage. Do something. If anybody's in the house that can help you out, your mom, your dad, your sister, your cousin, your friend, anybody, let them rub your back for 5 minutes and try to break up some of the muscle spasms that's going on in your lower back. That's what I did. That really does help a little bit. Ice 1 to 2 times a day, and try to find a hot tub if you can. That's probably hard, but that'll help you for a couple hours of relief after you get in and out. One of the big things you want to do is keep a journal. This helped me a lot. Put down what your pain level is every day, what you're eating every day, what physical therapy exercises you're doing every day, and if you set your back off, record what it is, what activities you did that made it worse or made it better, what stretches made it worse or made it better. So after about a month or two, you have something objective that you can look at. And one of the main things that I had to understand was that this is my problem, and I'm responsible for fixing it. So you want to take all these little steps that you can to try to help yourself out. Now onto the medications. You want to stay away from the narcotics. They're going to make you feel good for a little bit, the Vicodin, the Percocet, but in the long term, they're just going to get in the way of your recovery. They're going to make you feel good when your body really shouldn't be feeling good. So you're going to do something more strenuous that you should or shouldn't. Right now, I'm taking gabapentin, which is a nerve blocker. Please, if you have any nerve pain, ask your doctors about gabapentin. This thing basically saved my life. I started taking it 2 months ago, and that really helped me out a lot. It cut down like 50% of my leg pain. Tramadol, ibuprofen, some kind of muscle relaxer, but try to take 4 or 5 medications that can circumvent going the narcotic route. You know, take things. The narcotic should be a last case if you have chronic back pain, if you have herniated discs, if you have torn discs, if you have bad sciatic. Narcotics has to be the last choice prior to surgery. You need to short walks that help. I was at a point where I was doing a mile, and if I tried to do a mile, I'd be in bed for the next day in massive pain. So start off slow. The first 6 months of this, I had to do half a mile with a cane, and then you slowly get off the cane, and then you do try to build up to a mile or whatever it is that you feel comfortable with. And staying in bed and staying stagnant is not good. The more you stay stagnant, you're thinking that your body's recovering, but it's just making the muscle spasms worse. It makes everything worse. You need to move and just do what you can. That's basically it. Main things of this thing: control your eating, monitor your bending, try the gabapentin. It's a huge lifesaver. Just ask your doctor about it. If you're considering surgery, if you're considering anything, get the gabapentin. Physical therapy is huge. Chiropractor really didn't work for me. Massage therapy is good. Acupuncture really didn't work for me. I've tried almost everything. You need to strengthen your core while you can. Strengthen your body while you can, even though it's probably going to go not that good because you're not moving all day. Another basic thing is to end off. You're the protector of your own body. If you don't feel comfortable doing something while you're in pain, whether it's cleaning the house or helping somebody out, you just need to tell them that you don't feel comfortable doing it until you feel better. Don't worry about people saying anything or busting you up about it. You need to be the one that protects your own back. So I'm going to come out with another video the 26th of next month. I'll be getting my surgery. I'll do a video a day after that, and then 4 weekly videos monitoring my progress. Okay?